So this was a couple of years of me just getting sicker and sicker, and then ultimately getting this final diagnosis. And at the same time, I was provided an opportunity to leave what was the traumatic situation that was also keeping me so ill, and to start treatment at a mental behavioral health center. So you still with me at this point? To recap, I am still improperly diagnosed with mental illness. I am properly diagnosed now with diabetes, so at least I'm receiving some sort of medical care, moving in that right direction, and now I'm about to enter a mental and behavioral health program. This is where I had an intimate experience with just how broken our current, especially mental health care system is. Obviously, I've spoken to the medical side of things. You know, the blessing of this is that I did have Medicare, and so I was able to spend 13 months in this treatment center, and which is a really long time. And unfortunately, the reality is, because of the lack of resources and because of the fundamental education of our current system, the majority of people, myself included, were actually continuously more traumatized than when they entered. Because, you know, like myself, you're seeking help when you're at your lowest point, the lowest of lowest points. At the same time, you're expected to somehow be an articulate advocate for yourself, which is completely unreasonable. And, you know, my situation, I was very fortunate. Most people, depending on your insurance, I mean, some people were fighting for 7 days, 14 days maximum to get better. Nothing about their circumstance had changed. The whole system, you know, from the beginning is incentivized by the insurance companies, and, you know, it impacts the patients, you know, when you feel like this is your last chance for help and it's not going to happen for you. That's a very dark place to be. And that's, again, why I'm so passionate today about bringing the modalities to our medical system that helped me. So to summarize, the therapist that I was provided was trained in Buddhism. He actually had his bachelor's in Buddhism. I didn't know that that was a thing that you can do. Okay. And this was, you know, kind of, I look at it as divine intervention, because this is really where the first seeds were planted for me to be exposed to Eastern philosophy. Buddhism was completely new to me. But I had just, you know, survived this near-death experience, truly. And, you know, we were speaking before we began about neuroplasticity. And I've spoken to some other people who have had near-death experiences as well. And it's so interesting how the world works, because now I find myself working with technology that is based upon a near-death experience and can replicate it. But the neuroplasticity that I experienced after all of that trauma, after my near-death experience, was so profound that, you know, in retrospect, it was really easy for me to adapt a whole new way of life, because I was essentially starting from scratch. I really, you know, mentally, physically felt very infantile, but also, I mean, just fertile to regain myself. So this Buddhist therapist, in the early stages of my treatment, also helped me to identify, you know, what really was going on, that I was having extreme bouts of dissociation. I learned what that was. And at the same time, I was provided techniques like meditation. You know, part of this program was doing things like CBT, DBT, cognitive behavioral therapy, dialectical behavioral therapy. And, you know, these are fundamental tools that I honestly feel like every human being should go through at some point in their life. I feel like we should all go back to school and just get a tune-up, and there's no shame in that. So while I'm kind of reconstructing what it is to be a human, and adopting, these new holistic ideas and way of viewing things, I became conscious again. I had lived truly years out of my body. My dissociation through all of this had just separated me from myself completely. And as I began to, use these meditation tools and techniques, I realized, like, I don't think that this story applies to me. I don't think that this is really right. Like, I think that we made a mistake, people. Like, I don't think that I'm actually this diagnosis. And that is, that's a tough pill to swallow for any doctor. And, truly, I would say that most doctors would be unwilling to entertain that thought. I had, my team of medical professionals that were coaching me to essentially lower my expectations for life, because this is it. You are going to be on pharmaceutical medications for the rest of your life. I had lost my independence, my freedom. I was truly a dependent adult. I was stripped of my rights. I was stripped of the respect of the community. So I was basically told no. That's not possible. You're absolutely, properly diagnosed. But again, I'm fortunate because I had enough time, I was allowed enough time where my therapist saw behind the veil, right? Like, saw that there was perhaps some fertile soil here. And so essentially the way that I had to bring myself out of this, what I call being medicalized through this misdiagnosis, was in secrecy. I had to kind of start my own covert operation, N of one. And, I tried to be as forthcoming with my treatment team as they would allow me to. But essentially, my therapist didn't want to be lying to the doctor as much as possible. So he's like, I believe in what you're doing, but I'm not going to tell you to do it. Here's the DSM. For those who don't know, this is the manual that defines every mental illness, and ultimately was only truly created by a bunch of old white guys who are trying to give codes for insurance. It is not a way to define humanity. But regardless, so I'm I'm given in secrecy a copy of the DSM, and I'm armed with my continuous glucose monitor from my diabetes. And I basically have to do my own case study of titrating myself off of the medications, which is not easy. It is dangerous. I do not, suggest this to anybody, but this was the only opportunity that I really had. And then to come back and say, not only is this reflected in my blood sugar, and also let's look at, all the times that you're dismissing my emotions, like, oh, turns out my blood sugar is like over 400 at these times. And, there's other factors here that could explain beyond it just me being broken, or it must be this proper diagnosis. And also, once I had successfully, taken myself off of essentially all of these medications, and I had still, remained trusted. It took months, but I did change the minds of my treatment team.